Welcome to our in-depth exploration of illness anxiety disorder, a condition characterized by excessive worry about developing or having a serious medical illness. Over the next 10 minutes, we'll examine the nature of this disorder, its impact on those affected, how it differs from normal health concerns, and the approaches that can help those struggling with this challenging condition. Illness anxiety disorder, previously known as hypochondriasis, represents a significant shift in our understanding of health anxiety. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, this condition involves preoccupation with acquiring or having a serious illness, despite minimal or absent somatic symptoms. When mild physical symptoms are present, the individual's distress stems not from the symptoms themselves, but from excessive worry about what they might indicate. This persistent preoccupation persists despite appropriate medical evaluation and reassurance, causing significant distress and impairment in daily functioning. To truly understand illness anxiety disorder, we must distinguish it from normal health concerns. Most people occasionally worry about their health, especially when experiencing unusual symptoms or after learning about an illness affecting someone they know. This normal vigilance can be protective, motivating appropriate healthcare seeking. In contrast, individuals with illness anxiety disorder experience persistent, intrusive thoughts about illness that are difficult to dismiss even with medical reassurance. Their anxiety becomes all-consuming, significantly interfering with work, relationships, and quality of life. Consider Michael, a 35-year-old software engineer who noticed a small, painless lump on his neck. Despite his doctor's examination determining it was a benign lymph node, Michael became convinced he had lymphoma. He spent hours researching cancer symptoms online, checking his body multiple times daily for additional lumps, and seeking second and third medical opinions. His anxiety was so severe he had difficulty concentrating at work, withdrew from social activities, and experienced panic attacks when reading about cancer. Michael's case illustrates how illness anxiety disorder isn't simply being health conscious, it's a consuming preoccupation that substantially impairs functioning. Illness anxiety disorder affects approximately 1 to 3% of the general population, though milder forms of health anxiety are much more common. It typically begins in early to middle adulthood, though it can emerge at any age. The condition often has a chronic course with fluctuating severity, frequently worsening during times of stress. Interestingly, the specific illness feared may change over time. A person initially preoccupied with heart disease may later shift their concern to cancer or neurological disorders. Two distinct presentations of illness anxiety disorder are recognized: the care-seeking type and the care-avoidant type. Individuals with the care-seeking type frequently visit healthcare providers, undergo numerous medical tests, and seek repeated reassurance about their health status. In contrast, those with the care-avoidant type tend to avoid medical appointments, hospitals, and health-related information due to fear of having their worst fears confirmed. Both patterns can create significant problems: excessive healthcare utilization in one case and potentially dangerous delay of necessary medical care in the other. What causes illness anxiety disorder? Research points to a complex interplay of biological, psychological, and environmental factors. Biologically, individuals with this disorder may have heightened sensitivity to bodily sensations, interpreting normal physiological processes as threatening. There appears to be some genetic component, with the condition sometimes running in families. Neurobiological research suggests differences in how the brain processes and responds to bodily signals, particularly in regions involved in body perception and threat detection. Psychological factors play a crucial role. Certain cognitive patterns are common in illness anxiety disorder, including catastrophic misinterpretation of bodily sensations, assuming the worst possible cause for any symptom, hypervigilance to bodily changes, and intolerance of uncertainty about health status. Many individuals with this condition hold dysfunctional beliefs about health and illness, such as any symptom is a sign of serious disease, or if doctors can't find what's wrong, they must have missed something. Early life experiences significantly influence the development of illness anxiety. Childhood exposure to serious illness, either personally or in a family member, can create lasting impressions about health vulnerability. Some individuals may have received special attention when ill as children, unconsciously learning that the sick role brings care and concern. Traumatic medical experiences or growing up with parents who were excessively worried about health can also contribute to the development of these patterns. The media environment plays a non-trivial role as well. We live in an era of abundant health information, with medical websites, television programs about rare diseases, and social media constantly exposing us to illness narratives. For vulnerable individuals, this information overload can trigger or exacerbate health anxiety. The phenomenon of hypochondria, escalating health anxiety through online symptom searching, has become increasingly common in our digital age. Diagnosing illness anxiety disorder requires careful assessment by healthcare professionals. According to DSM-5 criteria, diagnosis includes preoccupation with having or acquiring a serious illness, excessive health-related behaviors or maladaptive avoidance, persistent worry despite appropriate medical evaluation, and symptoms persisting for at least 6 months. Importantly, if a somatic symptom is present, the preoccupation with its seriousness is excessive, distinguishing this from somatic symptom disorder, where actual physical symptoms are more prominent. The diagnostic process typically involves ruling out potential medical conditions, assessing the nature and impact of health worries, and evaluating for co-occurring mental health conditions such as generalized anxiety disorder, obsessive-compulsive disorder, or depression, which frequently accompany illness anxiety disorder. Clinicians must approach this evaluation with sensitivity, as individuals with health anxiety often feel dismissed or not taken seriously when psychological factors are discussed. Treatment for illness anxiety disorder is most effective when it combines several approaches. Cognitive behavioral therapy, CBT, has demonstrated particular effectiveness, helping individuals identify and challenge catastrophic health-related thoughts, reduce checking and reassurance-seeking behaviors, and develop more balanced interpretations of bodily sensations. For example, someone might learn to reframe a thought like, "This headache means I have a brain tumor," to "Headaches have many causes, most of them harmless, and I've had them before without serious consequences." Exposure therapy, a component of CBT, gradually exposes individuals to feared health-related situations while preventing avoidance or safety behaviors. Someone with cancer fears might be guided to tolerate reading an article about cancer without immediately seeking reassurance or checking their body. Over time, this reduces anxiety through a process called habituation. Mindfulness-based approaches have shown promise, helping individuals observe bodily sensations without becoming caught in cycles of catastrophic interpretation. By learning to experience physical sensations with acceptance rather than fear, patients can reduce the emotional reactivity that often amplifies health anxiety. Medication may be beneficial, particularly when comorbid conditions like depression or generalized anxiety are present. Selective serotonin reuptake inhibitors, SSRIs, have shown effectiveness in reducing health anxiety and improving quality of life. However, medication works best when combined with psychological interventions rather than used alone. The doctor-patient relationship plays a crucial role in managing illness anxiety disorder. Establishing a trusting relationship with a primary care provider who understands the condition is invaluable. Regular, scheduled appointments, rather than emergency visits triggered by anxiety, create a structure for addressing health concerns appropriately. Effective providers validate the patient's distress while avoiding unnecessary tests or treatments that may reinforce anxiety. They focus on improving functioning rather than providing repeated reassurance, which often provides only temporary relief before anxiety returns.